Thank you for taking the time to listen to this review. My name is Sarah Shaw, and at the time of Kim's death, I was a designated nurse for children and looked after children in Portsmouth. As Kim was pregnant when she died, it was agreed for the review to include services that were supporting Kim and her unborn baby. As the chair of the Learning from Children Practitioners Review Committee, it was agreed I would be best placed to support the review alongside my colleague David.
I'm David Jones and was the independent consultant who led the learning review with Sarah Shaw. I wasn't working for Portsmouth at the time of Kim's death, but joined the council soon afterwards as the interim deputy director of adult care covering for sick leave. So the knowledge of local agencies, individuals and policies was very helpful in undertaking the review. The focus of the Safeguarding Adults review was on learning, not apportioning blame. Even though we did not have a statutory requirement to undertake a review, we thought it was very important, and we were committed to learning from good practice, looking at what went wrong so that services and practice could be improved to reduce the risk of future harm. And we also worked closely with Portsmouth Safeguarding Children's Partnership on this review, as Kim was pregnant when she died. So it was very much a joint review.
We used a very inclusive learning review methodology, which involved many people from all the agencies who knew Kim, frontline staff and managers. Kim's family were involved in the whole process. We spoke regularly with them, and her sister attended the first session and told us about Kim, which helped to keep her at the centre of all our reflections and as we developed our recommendations.
We wanted to keep Kim central to the review and focused on her lived experience. Kim managed to successfully control her substance misuse in her 2 previous pregnancies and was supported to care for her babies in their early months within mother and baby accommodation. With her agreement, her family became legal guardians for her older children, and she was supported to maintain contact with them both. At the time leading up to her death, Kim was having to cope with all of these issues identified on this slide. Professionals judged the risks she was experiencing during this pregnancy were higher than previous ones, particularly in terms of being able to keep herself safe from domestic abuse and from substance misuse. Kim's parents and her sister were very involved in the review and provided a lot of detail about what Kim was like and the family experiences during the period leading up to and after Kim's death. At the first workshop, Kim's sister attended and provided an overview who Kim was, what she was like as a sister, daughter, mother, and asked us as professionals to be honest and learn from Kim's death.
A number of agencies were involved in working with Kim, and she expressed the view that it was rather overwhelming with the sheer number of professionals involved in her life. During the review, we looked at whether the focus had been so much on the unborn child to the detriment of seeing Kim as a vulnerable adult, and how we could learn from good practice and what could have been better, and how we can learn from how we, as a range of professionals, worked with Kim.
This slide provides a snapshot of what was happening in Kim's life during her pregnancy. There are more details in the report about how events unfolded up to and after Kim's death. Kim tried to abstain from substances as she had in her previous pregnancies. She was supported to complete an inpatient detox, but when she was discharged, there were communication issues about where to collect her methadone. As there was no backup process for her to access her methadone at the weekend, she ended up using substances. There is very little known about Kim's partner and her ongoing relationship with him. When he became homeless, the risk to Kim increased. Kim was placed in the registry, which is part of the Rough Sleeping Pathway and provides a high level of housing support for 41 adults. It was challenging for housing services to find accommodation to meet her needs due to Kim's level of substance misuse and the risk posed by her partner. Kim had had hospital admissions due to suspected overdoses and physical health problems, and also due to concerns of the welfare of her unborn baby. Kim was found unconscious in her room at the registry by staff making a welfare check. An ambulance was called, and despite their best efforts, sadly paramedics pronounced Kim and her unborn baby deceased at the scene. During our conversation with Kim's family, these were the two key points they asked the review to answer. It became apparent that Kim had shared some views with her family that she hadn't shared with professionals. This shows the need to develop trusting relationships and build rapport and ask curious questions. It can be hard for professionals to understand someone's lived experience. The methadone incident was a result of a problem with communication between Kim and professionals who did try and put plans in place for Kim to collect her methadone over the weekend. However, there was no backup plans when these fell through, resulting in Kim using substances.
What were the findings? We identified some excellent work by the children's social worker who provided continuity of care, which isn't always possible in practice, and she worked on the pre-birth planning, working closely with Kim and her family. Kim's wishes around detox were respected and were acted upon. Areas we identified for improvement included the need to develop and coordinate a plan separate from the plan for the unborn baby, to focus on the adult's needs as well. It was also apparent that there wasn't always an understanding of the role and responsibility of all the different agencies, and communication needed to be improved. We asked, could a team around the worker approach have been used? Another finding was the importance of taking a person-centered approach to domestic abuse. Services didn't explore how Kim could keep herself safe, and she felt that services were trying to stop her seeing her partner. After Kim's death, the family felt there was an ineffective follow-up in communicating and supporting them. So again, there is important learning. And we kept on coming back to the importance of risk assessment and how well understood the current arrangements are and how they can be used more effectively.
The review identified some important areas for improvement. The lack of access to methadone at the weekend is included in the action plan. Also, the lack of appropriate accommodation and support options for adults with complex needs who are experiencing homelessness, are pregnant and misusing substances. Albeit a small group, it's very important that commissioners work to improve the availability and increase the availability of services and support. It can be hard to avoid preconceived ideas. For example, we may label people as homeless people and make assumptions rather than seeing them as an individual currently experiencing homelessness. It is important that everybody is aware of unconscious bias and work to avoid this in their practice.
As we come to the end of this presentation, we would like you to reflect on what you have learned. Please take some time or talk to colleagues about some areas you will change in your practice. We hope you found this presentation helpful. If you would like to read the report in full, please click on the top link on this slide. The remaining links will take you to other resources linked to this review. Both the Adult Board and the Children's Partnership offers safeguarding training. For further details, please follow the training links on this slide. Finally, we would like to thank Kim's family and all the representatives from the different agencies for their contribution during this review.